So today we will cover chapter 4 from your syllabus, and we will be studying few topics that includes confidentiality, patient rights, bill of rights, and informed consent. So confidentiality. So what is confidentiality? Confidentiality is the right of an individual to have personal identifiable medical information kept private. Such information should be available only to the physician of the record and other healthcare and insurance personnel as necessary. In general, we usually say it is keeping up a secret or private matters. So generally it is nothing but keeping up a secret, we say. In the most easy way, we can say it as keeping up a secret or private information. So it means it is not telling anyone other than who should know or who is in need to know. Similarly, being in a medical profession, one should always know to maintain, and one should always know the importance of confidentiality. So this not only includes for the clinical data of the patient, such as the lab findings or the diagnosis, not only applicable to the clinical data, but it also applies to the personal identification data of the patient. So next, what is confidentiality in healthcare? So why do we need to have confidentiality in healthcare, and why one should always stick to confidentiality in healthcare? The first thing, it protects the medical information and records from being released to unauthorized people or parties. Secondly, confidentiality means that the practitioner should keep a confidence between themselves and the patient as a part of good care practice. Thirdly, this means that the practitioner should not tell anyone what a patient has said and their details other than those who need to know. So maintaining a confidentiality in a hospital sector is one of the key roles, and it acts as the pillar among the healthcare professionals. We need to protect private data not just as a matter of respect, but it helps to retain the trust and belief between the doctor and the patient. Mainly, this is concerned with the belief and trust among the patient and the physician. We can say sometimes we also share our secrets and our most private matters to only people who we trust and not to everybody, right? So we know what are the circumstances if we share our secret to others. So we probably will not, if the person tells our secrets to everybody, then finally we will not trust that person again. And sometimes we may not even trust people altogether. We may have a wrong idea about our friends, right? So that is the idea of trust in the foundation of any medical care, and that is why patient confidentiality is very, very, very important in healthcare. Next, what is patient confidentiality? Patient confidentiality means that personal and medical information given to a healthcare provider will not be disclosed to others unless the individual has given specific permission for such release. Because the disclosure of personal information could cause professional or personal problems, patients rely on physicians to keep their medical information private. So Thirdly, the most benign breach of confidentiality takes place when the clinicians share medical information as case studies. If this confidentiality is breached in any way, patient may have the right to sue the hospital or the physician. The greatest threat to medical privacy, however, occurs because most of the bills are paid by some form of health insurance companies, third-party payers, that either private or public. This makes it difficult, if not impossible, to keep information truly confidential. So here comes the term breach of confidentiality. Breach of confidentiality is nothing but this occurs when a data or information provided in confidence to a physician, like between a patient and physician, but if a physician discloses it to a third party without the patient consent, it is called breach of confidentiality. So it means we can clearly understand that without a patient consent, that is permission or agreement, we cannot disclose their information to anybody, not even to the own friends. So sometimes there are cases where breach of confidentiality occurs with health insurance claims, because usually the breach of confidentiality happens unintentionally in case of insurance claims, because the hospital has to provide the data, but every time the data cannot be given with the consent of the patient. So however, the Health Insurance Portability and Accountability Act of 1996 made it mandatory that all the informations regarding the patients and the customers should be only released with the help of patient's consent. So being in a hospital sector, we must take special precautions to safeguard the patient's information with confidentiality and also security. So there are few situations that leads to breach of confidentiality in a medical profession. So say for example, what are the situations that are creating breach of confidentiality? We can say it as gossiping between doctors or doctors and others. So the doctors in medical field are very highly potential to maintain the confidentiality of patient information. So gossiping is not the proper way to work in a medical field. So secondly, sometimes the physicians can forget, like we can say it as medical negligence or carelessness. Sometimes they leave the patient's important confidential information on the desk where others can easily access to the medical information. Thirdly, press and employers, relatives, sometimes in case of VIPs, or in case if somebody wants to know about a special person's information, the press can approach us, or sometimes the patient's relatives who are very keen to know what is happening to the patient can approach us. So in that case, we are not supposed to release the information, but there is a risk of releasing information due to certain carelessness. And the talks over the phone, it's also similar to the gossiping. So these are the possible situations that can lead to breach of confidentiality, and in few cases the health information can be released without a patient consent. So that would include notifiable infectious diseases. It can be released to the designated health authority. Infectious diseases where the person with disease is a risk to the community. So we can also say we can also give an example of the current situation of COVID-19. So in that cases, we cannot abide to the rules of confidentiality when it is necessary and mandatory to release the information, though we do not have patient's consent. So in that cases, we can release the patient's information to the health authorities. Sometimes the court produces a subpoena, which is a written court order to witness, to send the information of the patient as a witness. So in that case, we can release the patient information to the court without the consent of the patient. Next, we can see about treatment providers. Sometimes the doctors has to consult the cases with the other senior consultants. So in that case, they will not require any consent, since this is only regarding the treatment plan. Next, the third party payers, or we can say it as insurance companies. So these are the situations where we can release the patient health information without patient consent. So next, we are going to see about patient's bill of rights. That is nothing but rights of patient. In Tamil, we can say it is Tan Urimai. Sometimes we use the term rights, right? So we use it with our friends or with our close members or family members. While talking, we say rights, what rights you have, and we use that term very often. So I know most of you know the exact meaning of rights here. So here we are going to see about rights of patients. A patient is a person. Every person, whether well or ill, has the right to be treated with human dignity. A patient is a person with unique problem. A patient is a person who is suffering and needs help. It is necessary to recognize the rights. These rights are equal to those of anyone else in health. So the rights of patient usually denotes the conduct between the patient and the care providers. So every patient, as we all know, every patient has the right to access to the care with patient dignity and confidentiality. Sometimes we even forget what are the rights of the patients and what are the rights they have to question. Sometimes the rights are not clearly defined when they visit the hospital, and often they don't even realize what rights they have to question. So they usually forget. Even us, when we go to like any shop or something, for example, we tend to ask, we go and ask about the price money, and we compare it with other products or something, and then we even question the people who work there. So why we question is because it's our money, we are spending money, so we have the rights to question about it. So similarly, every patient has rights to question about the care that they are going to receive. So this not only includes the patient and the physician. The patient has rights to all other healthcare providers like hospital insurers, like laboratories, even the housekeeping, and they have rights to ask any kind of doubts that they have, and we are responsible to answer them. So for that, the government has created a few bill of rights, like few steps that we have to follow. So it is called Bill of Rights. So there are a few points in Bill of Rights. This was created to guarantee the patient from his freedom towards the specific statement of rights. So every hospitals, sometimes we even see in our hospital also, we have the patient rights boards in the entrance and even in the OPDs and all. So this is only displayed for the patients to know what rights they have during their course of treatment. So the first point says the patient has the right to considerate and respectful care. As we all know, we need to respect the patient and they deserve it. Secondly, the patient has the right to obtain from his physician complete current information concerning his diagnosis, treatment, and prognosis in terms the patient can be reasonably expected to understand. So every patient who visits the hospital has the rights to know about their current health status and about what is going on with their health and what are the risks involved and how long it will take time to cure. So what is the exact diagnosis and what would be the prognosis after treatment. So they have all rights to know or to ask the physician about themselves, about their illnesses. Thirdly, the patient has the right to receive from the physician information necessary to give informed consent prior to start of any procedure or treatment. So the patient has the rights to know about the illness before getting the consent, before getting the informed consent. So this means that in every healthcare sector, the patient has to be first explained about the illness before obtaining the consent from the patient. Next, the patient has the right to refuse treatment to the extent permitted by law and to be informed of the medical consequences of his action. So in any chance, we cannot force anybody to take treatment if the person is not willing. So the patient has the rights to refuse the treatment. We cannot say that we cannot force them to continue the treatment if they are not willing. So whatever be the consequences, whatever be the complications, the patient has the right to refuse the treatment, and we will also have to release the patient from the treatment. Next, the patient has the right to every consideration of his privacy concerning his own medical care program. So if the patient wants to be private, the patient wants to keep all his informations private with the physician has to respect, and so the patient has the rights to decide about his privacy. The patient has the right to expect that all communications and records pertaining to his case should be treated as confidential. Not most of the patients who visits the hospital, not every patient wants to maintain confidentiality, but most of them wants the professionals to maintain confidentiality. Even in case of a small skin problem, or even in case of hair fall, even if the patient visits for a hair fall, some expects the confidentiality with the physician in case of inconvenience. So they have the rights to expect to maintain their records as confidential. The patient has the right to expect that within its capacity, a hospital must make a reasonable response to the request of the patient for services. So sometimes even us, when we deal with patients, we lose our temper and sometimes we even shout when they keep asking us questions, right? So it is really very wrong, because they have the rights to request us to know, and we are in major position to clear out their problems and doubts. The patient has the right to obtain information as to any relationship of his hospital to other healthcare and educational institutions insofar as his care is concerned. So sometimes the patient may want to stop the treatment here and wants to continue a treatment in a different hospital. So sometimes the patient may live far from the hospital, so when they go back to their own places, they wish to continue the treatment at their own place. So in those cases, they have the right to obtain their personal information. So if they request for the information of all the details from starting till the end point, we are bound to release the information to them with respect. The patient has the right to examine and receive an explanation of his bill regardless of the source of payment. So before starting any treatment, it is our duty to, being workers of the hospital, it is our duty to explain to them about the cost and the bill of the treatment. Even though the patient does not seem like going to take treatment from the hospital, but if they want to know about the bills, we can explain to them without any quarrels. The patient has the right to be advised if the hospital proposes to engage in or perform human experimentation affecting his care or treatment. The patient has the right to refuse to participate in such research or projects. In most of the research hospitals, even we are one of the research hospitals in our place. So sometimes we want to perform a research on a patient. If we receive any new cases, if we receive any new diagnosis, so we want to do some research on that person or experiment him to find a proper solution for the treatment plan. But if the patient is not willing to experiment him or her, they have the right to refuse to participate. Next, the patient has the right to expect reasonable continuity of care. He has the right to know in advance what appointment times and physicians are available and where. So they have the right to know about the future plans, future care of plans. So sometimes the patient asks for the next review if the physician is available. Some are very comfortable with consulting the same doctor for the continuity of care. So in such cases, the patient has right to know about the physicians. The patient has the right to know what hospital rules and regulations apply to his conduct as a patient. So as I said earlier, so the patient has the rights to know about the rules of the hospitals and the rights of the patients, what conduct does a patient has. So they have the rights to know all those things. So the next important topic that any healthcare professional must know is consent. Even you might have heard the word consent very often. What is consent? Consent is a written agreement obtained from the patient to permit the course of action. So we say it is the written agreement from the patient, or accepting that they are okay with the treatment, or they are okay with any kind of tests, diagnostic tests that are performed on them. So just prior to the treatment, we obtain consent from the patients. So there are different types of consents. We say informed consent, express consent, implied consent, proxy consent. So among these, we will be studying in detail about the informed consent, but I will also explain the other types of consent. First, informed consent. Informed consent is a process by which the patient learns about and understands the purpose, benefits, and potential risk of a medical or surgical intervention, including clinical trials. It generally requires patient or responsible party to agree and sign a statement confirming that they understand the risk benefits of the treatment or procedure. So informed consent, the word itself says clearly that it is an informed consent, which means that the patient should be clearly informed about their illness, their diagnosis, their treatment plans, and about the cost, how much it would take for the treatment, and what would be the prognosis in the end, and what would be the complications of the treatment, and so on. So even if we are performing a research on that, the research scholar must inform the patient for the purpose of the research and why they are doing, and for what will benefit the research that is made on the patient. So everything that has to be clearly informed to the patient on their own language, not just English, in patient's own language. Informed consent is nothing but the patient has to understand, so we have to explain it in their own language and make them understand the purpose of the treatment. Next, what are the basic elements of consent? So what do we need to explain to the patients before obtaining a consent? Firstly, detailed description of the proposed intervention. So what is the proposed plan, what they are going to do from the beginning till the end, that is from the diagnosis. Secondly, we should explain the exact cost of the treatment plan. So how much ever is going to be spent by the patient, we have to inform the patient clearly about the cost that will need for the proposed plan. Thirdly, the risks involved during the treatment or procedure. So what are the risks that will be involved? So we can say, for example, while performing a surgery, for example, a female patient is proposed for LSCS, but the patient has other problems in the uterus. So the uterus has to be removed. Only when the physicians operate the patient and see with the naked eye, they will know the problems that that arises from the uterus, which is totally not involved in the proposed plan. So in that case, the physician has to remove the uterus. So in that case, the physician cannot obtain the consent from the patient, so they will just do the procedure. So those are the types of risks that could be involved during the treatment. Fourth, complications, if any. So sometimes, for example, patient with fracture who undergoes for a ORIF implantation or any implantation or screw fixation, they will have future complications like back pain. Like the patients who undergoes for sedation, especially the spinal anesthesia, sometimes causes the back pain in most of the patients. So those kind of complications can be explained if there is any. So these are the basic elements that has to be explained before obtaining consent from the patient. So there are few situations where the doctors can proceed in absence of consent. The doctors does not need consent in situations like when patient is unconscious. If the patient is unconscious, or if the patient has no relative accompanying, in that case we can start off the procedure or treatment without the consent of the patient. The patient is a minor. So if the patient is a minor, like the actual age for obtaining consent is 18 years and above. So below the age of 18 they are considered as minor. So if the patient is minor and if there are no relatives or parents accompanying the patient, in that case we can start off the treatment. But if the patient is a minor and has parents or guardian accompanying, we can obtain the consent from the parents or the guardians. When the patient's mental balance is disturbed, usually this denotes patients with mental retardation and other mental imbalance or illness. So these are the situations where the doctors can proceed without a consent. Thank you.